1961, a vinyl record arrives in the living rooms of thousands of American families. You won't find it in a store. You won't hear it on the radio. It arrives by mail, sent by the Women's Auxiliary of the American Medical Association, the organization of doctors' wives, to its local chapters, county by county. The instructions are simple. Host a small living room gathering, put on a pot of coffee, invite your friends, play the record. Then, each woman present has to write, in her own hand, in her own words, so as not to reveal that this is a coordinated initiative, a letter to her congressman or senator opposing what is being called socialized medicine. The operation is called Operation Coffee Cup. There was never any public announcement, neither of the record nor of the campaign. The goal was to make something look spontaneous that was in reality planned and centrally funded by a professional association. The voice on the record is that of Ronald Reagan, at the time an actor, former president of the Hollywood Actors Union, hired by the AMA for this task. We are not listening to an independent opinion. We are listening to paid material produced by a party that had a direct economic interest in the outcome of the debate. A fact worth keeping in mind before we hear the arguments. Why was it so much in the AMA's interest to block a public health plan? Two reasons, according to the historical record. First, if the government had become the main payer for medical services in place of millions of individual patients, it would have gained enormous power to set rates, exactly what had happened in the United Kingdom with the creation of the National Health Service in 1948. Second, and more surprising, according to historian Paul Starr, the AMA opposed universal insurance even when it would likely have increased physicians' overall income, because the real fear was not purely economic, but about professional autonomy. No outside authority, not even a public one, was to be allowed to dictate terms to the medical profession. This record, in other words, helped launch Reagan's political career 3 years later. It was precisely thanks to the visibility gained through this campaign that he was invited to speak for Barry Goldwater at the Republican Convention in 1964. Now let's hear what he said, point by point. One more thing before we go through this. What you're about to hear wasn't a speech, it was a script written for Reagan by an industry group with millions of dollars riding on the outcome, then mailed to living rooms disguised as somebody's honest opinion. We're breaking down the most important claims against the historical record, but the full unedited recording is linked below if you want to check our work. Because the people who received this record in 1961 deserved better than being quietly managed by a lobby that assumed they wouldn't notice. They deserved the truth. So do you.
Now, back in 1927, an American socialist, Norman Thomas, 6 times candidate for president on the Socialist Party ticket, said the American people would never vote for socialism. But, he said, under the name of liberalism, the American people will adopt every fragment of the socialist program.
This quote has never had a verifiable source. Researchers and fact-checkers who have examined the entire archive of Norman Thomas's speeches have never found these words. Even Reagan's biographer, Lou Cannon, wrote that he found no evidence Thomas ever said it, and Reagan himself, when asked in 1968, could not point to its origin. It is, by all appearances, an apocryphal quote.
Our government is in business to the extent of owning more than 19,000 businesses, covering 47 different lines of activity. This amounts to a fifth of the total industrial capacity of the United States.
On this figure, it must be said honestly, we were unable to trace any source confirming it. We therefore cannot say it is false, But neither can we say it is true. It remains an unverifiable number.
Under the Truman administration, it was proposed that we have a compulsory health insurance program for all people in the United States. And of course, the American people unhesitatingly rejected this.
Here, the cause described is false, even though the outcome is correct. Truman's health plan was never put to a popular vote, let alone rejected by Americans. It died in a congressional committee after one of the most massive lobbying campaigns in U.S. history up to that point, led by the AMA, at an estimated cost of between $3 and $5 million to brand the plan as socialized medicine in the full swing of the post-war McCarthyist climate. Truman would later call this failure one of the bitterest disappointments of his presidency.
Now, Congressman Forand brought the program out on that idea of just for that particular group of people. But Congressman Forand was subscribing to this foot-in-the-door philosophy.
The 1957 Forand bill proposed hospital insurance for those already receiving Social Security. It was repeatedly voted down in House committee in 1958 and 1959, never reaching a floor vote. Calling this a foot in the door is a political judgment about someone else's intentions, not a fact, and should be heard as such.
Walter Reuther said, "It's no secret that the United Automobile Workers is officially on record as backing a program of national health insurance. And by national health insurance, he meant socialized medicine for every American."
The first part is true. The Auto Workers Union, led by Walter Reuther, really did support national health insurance. But the second part, that by this he meant the total socialization of medicine, is Reagan's interpretation, not a quote from Reuther, who, in his speeches, spoke of eliminating waste and inefficiency, not of abolishing private medicine.
In the last decade, 127 million of our citizens in just 10 years have come under the protection of some form of privately owned medical or hospital insurance. What is the Kerr-Mills bill? Without even allowing this bill to be tried to see if it works, they've introduced this King bill.
The figure about the general population may be correct, but it's misleading when applied to the elderly, who were the real subject of the discussion. In 1965, less than half of people over 65 had hospital insurance, compared to over 70% of the general population, because private insurers systematically avoided covering the elderly, considered too high a risk. And the Kerr-Mills Act, the law Reagan asks us to let work before introducing another one, 3 years after its passage, it covered less than 1% of American seniors. It had been adopted by only 28 of 50 states, and nearly 90% of spending was concentrated in just 3 states, New York, Massachusetts, and California. The procedures for obtaining assistance required people to have nearly exhausted their savings. It is historically considered a failed program, one that later served as the model for Medicaid in 1965.
At the moment, the doctors aren't equally divided geographically. So a doctor decides he wants to practice in one town, and the government has to say to him, "You can't live in that town." From here, it's only a short step to dictating where he will go.
This prediction can be checked with hindsight. When Medicare was passed in 1965, it imposed no government control over where doctors could practice, nor over how many patients they could take on. The system kept the fee-for-service model, with doctors continuing to bill patients directly. Physicians' income after 1965 rose. It did not fall. The professional freedom Reagan described as being at risk was never undermined in the way he predicted.
I know how I'd feel if you, my fellow citizens, decided that to be an actor, I had to become a government employee and work in a national theater.
This is not a factual claim, but a rhetorical comparison. Extending public health insurance to the elderly while leaving private ownership of medical practices and hospitals untouched is not comparable to nationalizing an entire artistic profession. No piece of legislation discussed in those years called for the direct government employment of doctors.
In this country of ours took place the greatest revolution that has ever taken place in world's history, the only true revolution. Every other revolution simply exchanged one set of rulers for another.
This is a philosophical claim, not a verifiable fact. It's a reading shared by some historians, but contested by others. Historians such as Gordon Wood and Bernard Bailyn have long debated how much of a radical break the American Revolution truly was, as opposed to an evolution of the British constitutional tradition. It should be heard as a point of view, not as an established fact.
James Madison, in 1788, speaking to the Virginia Convention, said, "Since the general civilization of mankind, I believe there are more instances of the abridgment of the freedom of the people by gradual and silent encroachments of those in power than by violent and sudden usurpations."
This quote is authentic. Madison really did say it in 1788 during the debate over ratifying the Constitution, but he was speaking about the general risks of the erosion of constitutional power, certainly not about 20th century health policy. Applying it to the debate over Medicare is an extension made by Reagan, not a judgment Madison ever expressed on this subject. Just before this closing line, Reagan had spent several minutes urging listeners to write letters to Congress. Here is how he wraps up that appeal.
If you don't, this program, I promise you, will pass just as surely as the sun will come up tomorrow, and behind it will come other federal programs that will invade every area of freedom as we have known it in this country. Until one day, as Norman Thomas said, we will awake to find that we have socialism.
This is a prediction, and predictions can be checked. The bill Reagan opposed became Medicare in 1965. More than 60 years have passed, and the United States remains to this day the most privatized healthcare system among high-income countries, with no European-style national health service. The cascade towards socialism that Reagan was promising never materialized in the terms he described. This is not meant to say which healthcare system is the best. That is still an open and politically charged debate today. It's only meant to compare a prediction made in 1961 with what actually happened in the 60 years that followed. A record designed to sound like the spontaneous voice of American common sense was in reality a commissioned piece of political marketing made for a client who had every interest in making sure that law never passed. It's worth remembering that every time a familiar voice tells us what we should think. Here's a question worth sitting with. If everyone pays into the system through their taxes, and everyone is supposed to be equally free under the law, is making sure a doctor's visit doesn't bankrupt someone really socialism, or is it just what that equality is supposed to look like in practice? Was this campaign ever really about freedom versus tyranny, or was socialized medicine a label chosen to make a question of fairness and human dignity sound like a threat? Let us know what you think in the comments.